Today, we are excited to welcome Sherri Brandon, Chief Executive Officer of Front Steps Housing and Services. Throughout Sherri's career, spanning over 30 years, she has consistently demonstrated a deep understanding of the pressing challenges faced by the community she serves. Under Sherri's guidance as the CEO of Front Steps since 2008, the organization has experienced unprecedented growth and has become a beacon of hope for those in need. Through her strategic foresight, she is transforming the organization into a dynamic force that addresses the social drivers of health. In addition to her leadership within the organization, Sherri is widely recognized for her ability to inspire and empower others. She fosters a culture of inclusivity, innovation, and continuous learning, attracting a team of dedicated professionals who share her passion for creating lasting change. Sherri has been recognized with numerous community service and leadership awards, including the Community Service Award from Cleveland Clinic Hospitals, the Outstanding Leadership Award from the Board of Directors of Transitional Housing, the FBI Citizens Hero Award, and the Tri-C Distinguished Alumni Award. She has also received the 2024 Ashbury Senior Computer Community Center Accolade of Philanthropy Award and the 2024 Nonprofit Leadership Award from the Mandel School of Applied Social Sciences, of which she is a graduate. And we are excited to have her here today to share more about the work of Front Steps Housing and Services. So please welcome Sherri.
Thank you so much. Thank you for having me this morning. I just want to get my presentation here going. Hope you got it. You would think that I had this thing up all morning and that there would be no glitches, right? And the minute you're ready to start doing something, then all the glitches come. So thank you this morning. Thank you this afternoon for the opportunity to speak to you today. I am Sherri Brandon, the CEO, and I have the privilege of leading this wonderful organization with a great team of professionals standing with me. I could not do it without a great team of professionals. Every day our work reminds us that dignity and survival. It reminds us about stability, having stability, the dignity of those who we serve, and then the survival of those that we serve. So today, I would like to discuss the powerful intersection of permanent supportive housing, mental health, homelessness, and why this convergence is so urgent in Ohio, as well as how Front Steps responds to the needs of our community. So Front Steps Housing and Services began in 1986. Three sisters of the Congregation of St. Joseph's, who was brassy enough to start this wonderful organization, has transitioned for quite some time. So today we have evolved into a behavioral health organization addressing social determinants of health. At Front Steps, we are on a transformative journey, and our purpose is to provide individuals and families with individualized integrated services to promote recovery, increase their overall health, and of course, psychological well-being and the quality of life. So when we look at, I think I moved too fast. When we look at, all right, there we go. So when we look at what we're really talking about in terms of defining the intersection, we're talking roughly about 1/3 of people are experiencing homelessness in Ohio and also live with serious mental illness. Chronic homelessness doesn't just happen, right? It's just not a circumstance. It's often the end result of untreated mental health conditions, substance use, trauma, and some medical conditions as well. And so the other thing is when you look at permanent supportive housing. So in Ohio, our continuum of care responded because there was a segment of individuals living in shelter who were considered chronically homeless. And so moved into a whole different model from a transitional model to more of a more stabilized permanent setting. And so when you look at permanent supportive housing, it's designed for the overlap. It's designed to address the social determinants of health. And so it provides stable housing and pairs it with behavioral health services and substance use services. This is the intersection with when transformation happens. I think you could hold on 1 second here, please. Because I think you guys were here. You guys were just a little off. And so now we go. And so now when we look at homelessness in the state of Ohio, we're looking at it from a snapshot. And so over 11,700 homelessness in Ohio in 2024 alone, over 11,000 people. 80% of those individuals were sheltered, 20% unsheltered, meaning they may have been living with someone, they may have been living on the street, or when we speak about shelter, they may be living in some type of homeless shelter setting. 30% of chronically homeless individuals suffer with both mental health, mental illness, and substance use disorder. And then when you look in Ohio, we rank 20th nationally in access to mental health and health care. So we're taking a look at, that's my mistake. So we're taking a look at in Cuyahoga County, right there. That's where we're at. So when you look at how Front Steps respond to eradicate homelessness, mental health, and substance abuse, we looked at the key components. We did our research first. We didn't want to just delve into anything. When our continuum was changing, it was changing nationally. And so we did our research and said, what could transitional housing be? What could we do to meet the needs of the community, be flexible and nimble, and create a model that would be a model that is a premier model that can service those in our community and be in a line with HUD and all the new regulations. And so we researched several options, and the option we came up with was the key components of housing first. And so when you look at the key components of housing first, we looked at the surge in homelessness, long-term homelessness, mental health, substance use disorder, and the housing first model. The housing first model resonated with Front Steps at the time because it provided not only housing, but it provided access to services. It addressed preconditions and then provided a foundation for recovery. And so when you look at it, we looked at fair housing. When you look at housing first, it's about fair housing. It's about tenant rights, the tenants having a lease that they would not otherwise get. It's about community integration, making sure that they're in a community where services are wrapped around them, but there's amenities where they live, just like anyone else. It's quick access to housing, so it's no precursor. The only precursor is chronically homeless. And so we're not looking at credit reports. We're not looking at backgrounds. We're not looking at how long were you employed. We're not looking at those things. We're just wanting to provide a safe, affordable housing, respect and empathy, and then voluntarily personalized services. So we understood that services were optional. And so because we had so many years in the field, so many years of providing the services, we delved right in. And so we began to look for a new location for the organization. And what you find here is our groundbreaking in June of 2019. We went through our whole groundbreaking ceremony. I won't bore you with the other details of how we got here, but what you're seeing here is our partners, and we're breaking ground on a new facility, 68 one-bedroom apartment complex. And our partners were Front Steps was co-developer, Pearl Development was our developer, CMHA provided our housing vouchers to us. Eden was our property manager. And then, of course, Ohio Housing Finance Agency was our tax syndicators. I mean, where we apply for the low-income housing tax credits. And then, of course, RDL was our architectural design. And so you also see this is our staff and our residents there. So excited that day to break ground on a new facility, a long-time facility. And so what we did was we have a 68 one-bedroom apartment complex. Now it looks crooked, but it's not in real life. It's not crooked. It's really straight. It's just the picture and the angle. So we have 68 one-bedroom apartments, and the amenities are on-site services. We're 24-hour operation of front desk. Employees are on call. The clinical team are on call. We have on-site laundry. We have exercise room. We have a on-site computer lab. 20 property management is here. Full maintenance staff is here, and on-site horticultural programming. And our intake process for coming into St. Joseph Commons is our partnership with Frontline's coordinated intake process. And so just to talk a little bit about our services and what we do. So we offer a broad range of behavioral health support options, all centered around the needs of our clients. All behavioral health services started with a comprehensive integrated assessment. So we do a diagnostic assessment on each of our clients, as well as using an ASAM. And this allows us to get a full picture of the individuals who have selected to receive services. It gives us a full a picture of the services that they need. Then we move into, we also offer integrated mental health and addiction services. And so we offer intensive outpatient services. We offer NIOP. We offer the NIOP program is basically 12-week program. And each week includes 3 sessions. And I wanted to spend a little time here because it's very important to understand the services that residents in permanent supportive housing settings receive. And so they receive 1 individual session during the week, and that's for counseling services. It's 3 IOP groups a week, and those run for 12 weeks. Then once they have received the educational component and they've gotten strength, then we move into what's considered the non-intensive outpatient services. And that is an additional 6-week course. And then, of course, aftercare is once a week, where individuals step down in their process and they gain a little more freedom in their life and begin to exercise and demonstrate everything that they have learned in their IOP program. We also have an art therapy program and a music therapy program. Both of these programs, participants learn a way to manage their stress. One of the things that we notice is that stress trauma is a huge barrier for many of our residents and the clients that we serve. Our services are not just for individuals who live in permanent supportive housing, but we provide these services to the community at large. We also offer peer support, a recovery support program, and it's providing to individuals with mental health and substance abuse and who have gone through the process just like the other individuals have as well. So when you start looking at, we look at self-help groups, evening groups we offer. Anything we offer is to empower our residents and empower the clients in the community. We offer housing stability. Housing stability is a program where we work with individuals in the community to maintain stability so that they're not in a homeless shelter and they're not calling us for housing. We want them to stay housed, and that's how Front Steps really make sure that we're working with individuals. And so when you look at our mission and how we manage our mission, we look at our treatment modality. We're very successful in what we do. And so our treatment modality framework brings together different therapeutic approaches to tackle not just individual symptoms, but the social and economic factors that impact mental health. It goes beyond biology and psychology to create treatment plans that are more holistic and effective. And it's client-centered as well. And so we work on what our clients are willing to work on. So we use trauma-informed care that provides safety and trust. We use harm reduction principles that reduce risk associated with substance use while supporting personal autonomy and engagement. Then we use motivational interviewing. And I think motivational interviewing is the framework that is really the key driver to individuals living in permanent supportive housing that are hard to reach, and individuals in the community who are struggling and are hard to reach, because it's a client-centered approach and it enhances motivation to change by resolving ambivalence. We use integrated dual diagnosis treatment where mental health and substance abuse is addressed at the same time. And then we use cognitive behavioral therapy, and that focuses on changing negative thought patterns and behavior to an evidence-based for anxiety, depression, and trauma. So it's an evidence-based program that we use. And so when we look at eligibility, ages 18 and over must have a diagnosis of mental health, SUD, individuals who are experiencing homelessness and have emotional distress. Residents of Cuyahoga County also qualify for our behavioral health services, insurance and process of obtaining insurance. They can have insurance, or they can be in the process of obtaining that, and we work with them as well. Agency accepts Medicaid and all of those medical benefits. Housing stability is really one of our cornerstone projects that we're working with the faith-based community initiatives. And what it is we provide rental assistance and utility assistance to TANF families in Cuyahoga County, helping them to maintain their housing. We do assessments, we do linkages to housing, and then we provide that powerful support to them so that they are not displaced. And so our impact for 39 years is 100% of our residents come from the homeless shelter or homelessness on the street before moving into PSH. 96% of our clients' engagement rate is excellent. In a model where individuals are not required to participate in services, 98% of our clients do participate in services. 95% success rate in maintaining housing 3+ years or more or greater. And many of them do move into the community and still maintain. 86 become stable on their medication. We know without housing, many trickle in and out of the hospital, many trickle in and out of psychiatric services. And so they're more stable when they're in a permanent supportive housing project. Families escape eviction in 2021 to 2024, over 350 families, because of our housing stability program, escaped eviction. And so when we look at a time of uncertainty, we look at what's happening in the world today. 3 things that we're doing, well, 4 things that Front Steps is doing. We're enhancing operational resilience, building cash reserves and tightening up our financials, cross-training our staff to be more flexible in in-service delivery. We're also doing a lot of social scenario planning to be more flexible in service delivery. And then deepening community partnerships is another key component, collaborating with other nonprofits, health systems, and local organizations, educating lawmakers. We're going to a National Alliance to End Homelessness. So really educating the community, educating the legislator, and then being a part of Cuyahoga County Human Services Chamber. We're also going through our strategic planning process. In times of uncertainty, our nonprofit is proactively engaging in a strategic planning process, using this moment to reassess our priorities, strengthen our resilience, and ensure we're positioned to continue servicing vulnerable populations regardless of external challenges. This process is not just about surviving change, but about adapting to leading through it. And so as a leader, we want to lead through the change. And in order to access our services, it's a single point entry. You contact our organization. We have an access to care manager. We have our website. And then we also have a partnership with Unitas Ohio for referrals. And that concludes my presentation. Here we have our horticultural program that we are so excited about. And in our horticultural program, we grow vegetables. We have flowers, the beautiful the bushes that we have, and our residents are the ones who keep that up. And so with that, that is the end of my presentation. Thank you again for the opportunity to speak.
Sherri, thank you so much for sharing such the impressive work of Front Steps. Let's talk a little bit about just kind of some of the services provided and kind of really how long can someone stay in your services and where might they go once they move beyond the services you provide?
So the services are here on site, and someone in its case management services, empowerment services to really help link individuals to services in the community, whether it's a medical doctor, their psychiatric care, food, clothes, whatever services that they need, they're on site. And individuals can stay here forever for as long as they need to. And many of them have moved into the community, into their own permanent setting. And so they go into apartment settings, housing settings. We have had no one to move into a situation where they move back home with their family members. They're all independent. We do find that there is an aging population of 55 and over. And so some of them have gone into a more stable setting for them.
You mentioned as part of kind of looking forward, deepening some of those community partnerships. What are some of the partnerships that you're looking to establish, or what are some of those needs that a partnership could help you address?
So in a permanent supportive housing project, not just in a permanent supportive housing project, but in individuals in the community who are challenged with mental health and are struggling to find some balance. One of the things that we're looking at is psychiatric partnership. We had a partnership with Ohio Alliance. We work with Care Alliance. Care Alliance come, and then we work with Premier Primary Health Care, who comes to provide some of the medical care to some of the residents who participate in that program. So, and we're just looking to partner with whomever we can to make sure that we're providing a holistic care for the individuals we serve. We partner with Cuyahoga Community College as well, with their interns in their nursing program, as well as the interns in their human services program as well.
Now, Sherri, you have been with Front Steps for a period of time, and over that time, I'm curious to get a sense from you of what have you seen evolve in the permanent supportive housing landscape? How have the client needs evolved? Where have things gone over the years?
So when we first came into the permanent supportive housing in 2014, and so it was a time of fragility, should I say? Staff was fearful. Staff was moving from out of the organization because they weren't sure how this would pan out. Even funders were uncertain about do we want to fund a project where people can stay there and not participate in services. And so as we work through the process, one of the things that we learned is, of course, as I said, motivational interviewing is really key to working with these individuals, but treating them with dignity and respect, showing them that you have an organization that really care about your well-being, no matter what level you're on. And so one of the things that we've noticed is that the aging in process, before that, we learned that many individuals who live here decrease their substance abuse use. They increase their medication, seeing their doctor, participating in their services, and those that are hard to reach, what we do is we try to find additional ways to reach them, and because many of them may not want behavioral health services. So we find other solutions that will draw them into whatever service that is client centered and something that they can engage in. And so we found that individuals do age in place. One of the other things we found was that medical care, many individuals in permanent supportive housing may not address medical needs. And so what we started doing was we bring the service to them. We bring the service to the building. And so those are some of the things that we've seen. Of course, the aging population who have medical conditions that's beyond their ability to really manage individually and permanently by themselves. And so they usually go into like a nursing home facility, something like that. I'm so sorry. Any other questions?
Absolutely. So let's take a look ahead. Let's 5 to 8 years from now. What's the vision that you have for the organization?
So 5 to 8 years from now, we are still passionate about both behavioral health services, making sure that we're in the community, taking services to homes and providing services in a client-centered approach. So we're still very passionate about that, and we can see ourselves doing that for quite some time, to come. We're also looking at additional housing opportunities for the clients in our community and for the community at large. And then just being a leader in the space, making sure that we're partnering and collaborating and doing some trainings and education and additional speaking engagements to help people in the community understand the importance of permanent supportive housing and affordable housing in our community and the diversity of those housing projects.
And how can those of us on this call today help you and your organization work to achieve that vision?
So I'm so glad you asked me that today. Um, One of the things that we're doing is because we're going through a whole strategic planning process, we're always in need of great board members who are looking to help forward the mission of this organization, and we look for volunteers to come in and do projects, projects with the residents. Some come in and do movies, some come in to do special talks. We have an exchange center that we are desperately in need of a volunteer to come in and help us to run that or to take it over and run it. And then monetary support. We have a development team who is really in need of, and the organization is always in need of monetary support. We are also, at the end of this year in January, we have one big fundraiser that we do, and it's our annual fundraiser, and it's called Home for All Ball. And we're going to be hosting it at the Windows on the River. We have tickets for sale, tables for sale. And we just would love for people to just bring friends, bring someone to learn about this wonderful organization. And as I said, we're transforming and we're about filling gaps. That's how the agency started as transitional housing. It filled a need, and that's who we are still today. We accredit that culture to the beginning and the start of this organization, that we're looking to fill gaps and be a greater force in the community. We're turning 40 years old in January. And so we're just looking to be more of a presence in our community, more of a voice in our community of the needs of individuals who have behavioral health in their home suffering to those who are living in permanent supportive housing.
Well, Sherri, we thank you for sharing the impressive work of your organization, and I will be sure to share the website to your organization in my follow-up email and encourage everyone on the call, if you are interested in getting involved and want to support, to please reach out to Sherri and her team to help support the work that they're doing in our community. So Sherri, thank you very much.
Thank you for having me. I appreciate the invitation, and I will see you all later. And hopefully we can find some partnerships with some of the folks on the line today.